Hey everyone, welcome back to Ask Dr. Slater. In this series, you get to ask me, a board-certified orthopedic specialist with 17 years experience in this field, your healthcare questions. So if you found this helpful, make sure to like and subscribe so you can submit your own questions that we'll be answering each week. Let's get to it. So I talk about how tinnitus, ringing in your ears, can actually be a neck issue, a problem from muscular imbalance or actually joint compression on certain areas of your neck. This person writes that they tried it and they said, yeah, now your shoulders and neck are so sore from shrugging that you don't think about the ringing in your ears, LOL. So this comes from just one simple move that I talk about as a shrug. Hold it, try to get up higher, hold it, and then really contract up at that top range. So this person tried that and says now his neck and shoulders are so sore. Well, just hold on a second and think about if you're so sore from just doing a simple shrug, that probably that's what you needed to do. This area needs to be worked. And if you're that sore from a simple shrug, then think about that area might have enough problems that, yeah, it could be attributing to the ringing in your ears. All right, if you have C5-C6 disc herniations, listen to this. This person writes that they have a C5-C6 disc herniation. Happened about 18 months ago, but they still have a lot of numbness and compression feeling in the thumb and pad, pins and needles in the right arm. They want to know, is this normal or do they have to live with this problem for the rest of their life? And then also he says when he plays darts, it really hurts. So yeah, C5-C6 actually innervates your thumb and pointer finger. So it's normal to have symptoms all the way down into your arm or certain areas of the arm, specifically into that area of your hand with a C5-C6 issue in your neck. So yes, it's normal to have symptoms with that problem, but it's not normal to have that problem. Do you have to live with it? No, it is very treatable. With the right movement, you will take pressure off of those nerves, restore the signal to that area, decrease the pain, numbness, tingling, restore strength, and it's pretty easy to do. A retraction is a very helpful exercise typically for this area. If it's normally one-sided, you might have to do something to that side. I have a neck course that will take you through all of this thought processes and all of these movements. It's $99. It's available on my website, thespinaltruth.com. So if you want to see something like that, it will absolutely help with these symptoms. Yes, they are common, they are not normal, and they are very treatable. You shouldn't have to live with this for the rest of your life. Why does bilateral pain mean a nerve issue? So I talk about these 5 symptoms that likely mean a nerve issue rather than a local joint issue. And one of them is if symptoms are bilateral, so if it's on both sides. So think about this if you have bilateral carpal tunnel. So carpal tunnel is compression of the median nerve at the wrist. Well, my right side wouldn't cause my left side. Okay, that just doesn't make sense and that's not the way it would work. But compression at my neck at a certain level, C4, C5, C6 can absolutely cause symptoms down into both sides of the hand. So it just makes more sense that if it's bilateral, that it will point you towards a spine issue. I'm not saying it has to be a spine issue, but it does make it more likely. This is going to sound like a lot of people who have neck pain. This person writes, I've had 54 injections in 2.5 years, 2 discs replaced in my neck with minimal to no help. They said my bottom disc is now moving and they want to fuse. It's unbelievable. And the problem is that the treatments that you're getting aren't treatments. I just did a podcast talking about this. Most treatments out there, like injections, aren't treatment. It's just managing and numbing your symptoms. And now you think, hey, I didn't respond to this treatment, so now I need a more aggressive treatment like a disc replacement or a fusion. And the problem is that these are very preventable, okay? You can absolutely treat these issues without medication, without injections, without surgery, and it's by knowing how to properly move and strengthen your spine. If you want to know more, I have a spine course, a neck course, thespinaltruth.com. But this is the treatment out there, treatment that a lot of people are getting, and it's failing a lot of people because it's not actually treatment. That's it for this week of Ask Dr. Slater. Make sure to leave your questions in the comments. Make sure to hit like and subscribe so you don't miss this series. Stay tuned next week.